I'm Jake, and we met when we were living in Ho Chi Minh City teaching for British Education Partnership. And that was such a fun time. What a fun time. I'm in Oak Park, Illinois, which is a suburb of Chicago, just west of downtown. It was mid-March, right around like the 13th, that we started we got a shelter in place order. I was really impressed with how they handled it because as soon as Oak Park had one case, that's like they immediately were like, okay, shelter in place ordered. So we had it a couple days, maybe 2 days before the city of Chicago. It's very, very state by state. Which, I mean, it makes sense to a degree because like there are way more rural areas where there is not as where keeping social distance is not as much of a problem at all. Um,
Yeah.
Whereas like very urban areas like Chicago and New York, we have to do this. We don't have a choice. But then like Florida reopened up their beaches, and Georgia, I think today decided to reopen it. So in 2 weeks, there's going to be another spike because it's a 3 day to 14-day incubation period. Um, and more people are going to get exposed and more people are going to die than need to. It would be impossible to prevent people from traveling from one state to another. But I know that I heard about some places saying like if you came from New York, you need to isolate for 14 days and don't go out, don't contact people. But it's such a large country, like there's no way to really like unless they are offering a place for these people to stay for that 2 week period of time. How are you really gonna you have to go kind of based on their word. You can go out for essentials, and that's pretty much it. They recently extended the shelter in place for Illinois through May 30th, but they're working on opening up like state parks and other other public places, but like saying that you have to wear a mask if you can't avoid being within 6 feet of 6 feet of other people. My cousin works at a grocery store, and he's still working. He's getting hazard pay, but my friends who are working in the hospital, like as ER techs or nurses, are not getting hazard pay or anything. I have friends that say like stop romanticizing the deaths of medical workers anticipate um, who didn't anticipate anything like this happening and being put at risk
Mhm.
due to a shortage of PPE. But they'll just hold like a press conference every day, and the governor and the mayor will talk about daily updates. And then I know that Trump has been giving daily updates as well, but those I don't really follow as much because I don't like it. It makes me a little mad. So,
I feel like you can get Trump's like updates as memes secondhand, though, so it's fine.
yeah. Yeah, no, that's usually the case. Like usually, I mean, I had to look up the disinfectant injection thing. Um and that was that was shocking. That was shocking. There are a fair number of people that support Boris Johnson, right?
Yeah, and I don't understand that at all.
See? I don't understand what's going on here either. The herd immunity thing that he was talking about was just like I was terrified for you guys. It's just like what this is killing people. We could do something about it, but just now, don't worry about it. We'll be good about washing our hands. And then, Dr. Anthony Fauci, he's been doing a great job, but like some, I don't know, people were posting things that were saying like Fauci is way smarter than Trump, whatever. And then like Trump was talking about firing him because he was just mad. It seemed like to me. The government sent out a $1,200 check to everybody who had, if you had filed your taxes for last year, then you were eligible to receive the check depending on how much you were making. So I don't remember like the exact values, but if you were making under, I think it was like under $65,000 a year, then you got a $1,200 check, and then as you made more and more money, the amount of money that you would get from the government went down. There were gifts that people made of like U.S. unemployment unemployment applications every year, and it was just insane because like you see this line and it looks like okay, it's pretty significant, and then 2020 and it just skyrockets, and all those fluctuations just look pretty flat relatively.
There are protests in basically every state where they're trying to reopen, right? Is that like a widely held view, do you think?
I don't think it's that widely. I hope it's not that widely held of a view. The area that I live in is pretty liberal, and so like here in Oak Park, you go outside and 90% of people are wearing masks just walking down the street. So I'm not seeing that. Also, I'm not going out really. But I read about it online and have some friends in Georgia that have been posting things about like, okay, like we're just gonna be the guinea pig. But I mean, there's already like there's already cases where like in Louisiana they had protests, and like it's not. I have friends on Facebook that are laughing about it, posting like, hey, this person was protesting and now they're dead. And it's like, people are dying. It's not funny. There is a little bit of just like, come on, like the fact that this became a partisan issue blows my mind, just because people are dying and there's something that we can do to help prevent it. I understand that you don't want the economy to take a hit, but if a lot of people die that don't need to die, the economy is going to take a hit too, So it's all about. I feel like it's all about gauging where you want to be at the end of it. Do you want to be more prepared and have come out on the other side and have people saying like that was blown out of proportion, or do you want to just try to have things be as normal as possible and then more people possibly die than need to? I don't know. People need to be encouraged to take care of each other, and instead of instead of just trying to do everything normally, because nobody alive today remembers the Spanish flu in 1918, and so it's new territory. We have all this technology. It's a matter of testing everybody that needs a test or has any symptoms of COVID, and seeing really where we're at, because without that we weren't, they were posting how many cases were in Illinois every day. But now that we just started testing a lot more patients here, and now the numbers are going up more, is the initial rate increase an accurate representation of the actual number of cases? Probably not, because, there are people who are asymptomatic, relatively speaking, that may just have like a runny nose and a light cough. And there are other people who are healthy, and for some reason it'll kill them. It's crazy. Like there's certainly no doubt in my mind that the tests that they're reporting as positive are positive, and negative are negative. It's just that the
cases that aren't getting tested, or even like deaths that are being attributed to the wrong thing. Like, do you have reason to doubt that, or?
No, I don't. It's because I've been, I don't know, Illinois has been doing a very good job, I think, of just getting a handle of things. Governor Pritzker has been great, as well as the mayor of Chicago, Lori Lightfoot. And they're trying to do their best. They're trying to get more tests. They converted McCormick Place, which is a big convention center, into a COVID hospital. So they can take on like a couple thousand patients there. And, it's just like somebody asked, I think somebody asked Pritzker the other day, they were like, what if we don't need, what, like all this money that we're pouring into setting up all this stuff, what if we don't need it? And he was like, I'm praying that we don't need it, but I'd rather be ready for it so that we can deal with it and try to save as many people as possible.
Your parents are also both in medicine. Do they feel that like the medical system that you've got at the moment is prepared?
I don't think so. I mean, they didn't have enough PPE. They didn't have enough masks, which is why the government was saying that, like, initially you don't need to wear a mask, but you look at like Asian countries where like South Korea and Vietnam and Taiwan especially, where wearing a mask is just commonplace. And if you're asymptomatic but possibly still spreading a virus and you don't know, and like you are wearing a mask, then great. That's not rocket science, that you're not spreading around as many of your particles. But I think that people initially thought, like, wearing a mask, I'm wearing a mask to protect me. And you got to think, I'm wearing a mask to protect other people from me, potentially. And especially, I mean, for myself, living with two doctors, it would be irresponsible for me not to, So I have a mask in my car.
Right now, do the people that work in hospitals and everything, do they feel safe? Are they scared?
I think it varies significantly from person to person. And it depends on what kind of a hospital they're working in, because the hospital that my dad used to work at in the city is not as well financed as some other hospitals. So like the emergency department there didn't have any, or maybe they had one room with a door, and they didn't have any way of doing like ventilation of rooms. What they can do is they have like kind of a big old thing that's sucking air up and filtering it out of the room, so particles are not gonna come out of that room if it's managed properly. The lack of that and just having curtains between beds, that's not the place that you want to be working with this current situation. Whereas other hospitals, I've seen pictures of friends that are completely covered in all of the necessary PPE in other parts of the city. So really, it varies. Well, my dad said that they're trying to test everybody that has some symptoms related to it. But it's like, I feel like every day you're hearing, or not every day, but pretty often you're hearing about some new symptom that is now connected to it, like conjunctivitis, pink eye, initially was not associated with it, and now they're saying that could be related to COVID. And then like the loss of smell and taste, that was an interesting one to find out about. But certainly if you have a fever and a cough, then they'll hopefully test you. I mean, if you're feeling like you just got a little bit of a runny nose and you don't have a fever and maybe you have a little cough, I personally, if it were me, I wouldn't jump to the conclusion that I was COVID positive. And that's kind of what's so scary about it, is that if you don't know and you don't feel that sick, you could get somebody else sick.
How accessible is it for most people to get healthcare, like for this?
for this, that is a good question. You know, we're the only country in the developed world that does not have universal health care. And that's that's a road. That's a long road we could go down. But I don't feel like I know enough about everything that's going on to accurately answer that question.
Mm.
Yeah, I mean, certainly if you're symptomatic and stuff, it depends on what your insurance is and what your insurance is willing to pay for. And there are so many different insurance companies that are involved that you could have, that some hospitals would accept and others might not. And so you'd have to go to a hospital that does accept your insurance. So yeah, it's not great. It's not great. I mean, I understand people's concerns about how would we finance universal health care for such a large country. But I think that it's something to strive for if we could kind of start heading in that direction. It's not going to happen overnight. But with that kind of idea and goal in mind, make good decisions about how to change the system. It's going to be some trial and error, and there are people who are worried about that, you know, and worried about taxes going up really high and taking away money that you have earned, and you feel that you don't want the government to take as much, you know. And then there are other people who are like, it's fine, tax me more and have the government worry about it, and I won't have to. So yeah, I mean, there are just so many moving parts.
You think that this might change people's mind about it?
I don't know. I mean, like, we talked about the protesters, you know, protesting closing down stuff. So like, there's evidence that says, hey, what we're doing, this shelter in place and stay at home and socially distance, is working, and we are flattening the curves. People don't look at the numbers, and they don't listen to. There are people who don't listen to science, and it's unfortunate, but it is what it is. So I don't know. This is what we know we can do. You know, this is all we can do. We can up our tests. We can work on a vaccine, and we can socially distance. And why not? You know, why not try and do that?
What long-term impacts do you see this having?
Yes, absolutely. I feel like it's a little hard to predict. Like the local stores here in Oak Park were, like, they were offering more delivery than they used to. Like the local bookstore here, my brother-in-law bought a book, and he called them. No, he wanted to get a puzzle. He got a puzzle, and like called them and was like, "Hey, I know, like, I love your puzzle selection. Just trying to support you guys and look for, you know, we want to get a puzzle." And so they were like talking to him on the phone. They were like, "Here, I'll text you all these pictures." So they texted him pictures of the puzzles, and he like picked one out and gave the store his credit card over the phone, and they were like, "Oh yeah, we'll just drop it off like in a couple hours." So I would hope that more local businesses start to do stuff like that, because they could compete with Amazon better if they could offer today delivery. Sure, it would probably be at a premium, but you're supporting a local business. But in terms of healthcare, I'd hope that hospitals are more prepared for something like this in the future, like more PPE on hand, just in the event that things get crazy really fast. But yeah, I mean, it'll be really interesting to see